السلام عليكم. محاضرة 12. Objectives, sleep apnea, hypoxia, and cyanosis. Sleep apnea means the absence of spontaneous breathing. Occasional apneas occur during normal sleep, but in persons with sleep apnea, the frequency and duration are greatly increased, with episodes of apnea lasting for 10 seconds or longer and occurring 300 to 500 times each night. Sleep apneas can be caused by obstruction of the upper airways, especially in the pharynx, or by impaired central nervous system respiratory drive. Obstructive sleep apnea is caused by blockage of the upper airway. The muscles of the pharynx normally keep this passage open to allow air to flow into the lungs during inspiration. During sleep, these muscles usually relax, but the airway passage remains open enough to permit adequate airflow. Some individuals have an especially narrow passage, and relaxation of this muscle during sleep causes the pharynx to completely close so that air cannot flow into the lungs. In persons with sleep apnea, loud snoring and labored breathing occur soon after falling asleep. The snoring proceeds, often becoming louder, and is then interrupted by a long silent period during which no breathing apnea occurs. These periods of apnea result in significant decreases in PO2 and increased PCO2, which greatly stimulate respiration. This in turn causes sudden attempts to breathe, which result in loud snorts and gasps followed by snoring and repeated episodes of apnea. The periods of apnea and labored breathing are repeated several hundred times during the night, resulting in fragmented, restless sleep. Therefore, patients with sleep apnea usually have excessive daytime drowsiness, as well as other disorders including increased sympathetic activity, high heart rates, pulmonary and systemic hypertension, and greatly elevated risk for cardiovascular disease. Obstructive sleep apnea most commonly occurs in older, obese persons in whom there is increased fat deposition in the soft tissues of the pharynx or compression of the pharynx due to excessive fat masses in the neck. In a few individuals, sleep apnea may be associated with nasal obstruction, a very large tongue, large tonsils, or certain shapes of the palate that greatly increase resistance to the flow of air to the lungs during inspiration. Most common treatments of the obstructive sleep apnea include: number one, surgery to remove excess fat tissue at the back of the throat, a procedure called uvulopalatopharyngoplasty to remove enlarged tonsils or adenoids, or to create an opening in the trachea, tracheostomy, to bypass the obstructed airway during sleep. 2. Nasal ventilation with continuous positive airway pressure with CPAP. Central sleep apnea occurs when the neural drive to the respiratory muscles is transiently abolished. In a few persons with sleep apnea, the central nervous system drive to the ventilatory muscles transiently ceases. A disorder that can cause cessation of the ventilatory drive during sleep include damage to the central respiratory centers or abnormalities of the respiratory neuromuscular apparatus. Patients affected by central sleep apnea may have decreased ventilation when they are awake, although they are fully capable of normal voluntary breathing. During sleep, their breathing disorder usually worsens, resulting in more frequent episodes of apnea that decreases PO2 and increases PCO2 until a critical level is reached that eventually stimulates respiration. These transient instabilities of inspiration cause restless sleep and clinical features similar to those observed in obstructive sleep apnea. In most patients, the cause of central sleep apnea is unknown, although instability of the respiratory drive can result from strokes or other disorders that make the respiratory centers of the brain less responsive to the stimulatory effects of carbon dioxide and hydrogen ions. Patients with this disease are extremely sensitive to even small doses of sedatives or narcotics, which further reduce the responsiveness of the respiratory centers to the stimulatory effects of the carbon dioxide. Medications that stimulate the respiratory centers can sometimes be helpful, but ventilation with C5 at night is usually necessary. Hypoxia is a general term which means inadequate oxygenation of the air, blood, or cells. The following is the descriptive classification of the causes of hypoxia. Number one, inadequate oxygenation of the blood in the lungs because of extrinsic reasons, such as deficiency of oxygen in the atmosphere, hypoventilation due to neuromuscular disorders. Number two, pulmonary disease, hypoventilation caused by increased air resistance or decreased pulmonary compliance. Abnormal alveolar ventilation perfusion ratio, including either increased physiologic dead space or increased physiological shunt. Diminished respiratory membrane diffusion. 3. Venous arterial shunt. 4. Inadequate oxygen transport to the tissues by the blood, such as anemia or abnormal hemoglobin, general circulatory deficiency, localized circulatory deficiency, peripheral cerebral coronary vessels, tissue edema. 5. Inadequate tissue capability of using oxygen, such as poisoning of the cellular oxidation enzymes. B. Diminished cellular metabolic capacity for using oxygen because of toxicity, vitamin D deficiency, or other factors. Inadequate tissue capability to use oxygen. The classic cause of inability of tissues to use oxygen is cyanide poisoning, in which the action of the enzyme cytochrome oxidase is completely blocked by the cyanide, to such an extent that tissues simply cannot use oxygen, even when plenty is available. Also, deficiencies of some of the tissue cellular oxidative enzymes or other elements in the tissue oxidative system can lead to this type of hypoxia. A special example occurs in disease beriberi, in which several important steps in tissue utilization of oxygen and formation of carbon dioxide are compromised because of vitamin B deficiency. Effect of hypoxia on the body. Hypoxia, if severe enough, can cause death of cells throughout the body, but in less severe degrees can cause decreased mental activity, sometimes culminating in coma, and to decreased work capacity of the muscles or fatigue. Oxygen therapy in different types of hypoxia. طبعا الأكسجين مو دائما هو مفيد في حالة الهايبوكسيا. تفيد في حالة إنه نقص الأكسجين ممكن يتقوى، لكن في حالة معينة الأكسجين ما راح يفيد في التريتمنت أوف hypoxia. Oxygen شو راح ينطي؟ can be administered by أولا either placing the patient head in a tent that contains air fortified with oxygen أو allowing the patient to breathe either pure oxygen or high concentration of oxygen from a mask, or 3. Administering oxygen through an intranasal tube. Recalling the basic physiological principles of the different types of hypoxia, one can readily decide when oxygen therapy will be of value, and if so, how valuable. In atmospheric hypoxia, oxygen therapy can completely correct the depressed oxygen level in the inspired gases and therefore provide 100% effective therapy. In hypoventilation hypoxia, a person breathing 100% oxygen can move 5 times as much oxygen into the alveoli with each breath as when breathing normal air. Therefore, here again, oxygen therapy can be extremely beneficial. However, this provides no benefit for the excess blood carbon dioxide also caused by the hypoventilation. In hypoxia caused by internal alveolar membrane diffusion, essentially the same result occurs as a hypoventilation hypoxia because oxygen therapy can increase the PO2 in the lung alveoli from the normal value of about 1 meter mercury to as high as 600 millimeter mercury. This raises the oxygen pressure gradient for diffusion of oxygen from the alveoli to the blood from the normal value of 60 millimeter mercury to as high as 560 millimeter and increase more than 800%. In hypoxia caused by anemia, abnormal hemoglobin transport of oxygen, circulatory deficiency, or physiological shunt, oxygen therapy is of much less value because normal oxygen is already available in the alveoli. هاي المشكلة مو بالأكسجين. فمن نعطي أكسجين ما راح يعطي النتيجة هواية. The problem instead is that one or more of the mechanisms for transporting oxygen from the lungs to the tissue are deficient. مثل في حالة anemia or abnormal hemoglobin or circulatory deficiency or physiological shunt. Even so, a small amount of extra oxygen between 7 and 30% can be transported in dissolved state in the blood when eligible oxygen is increased to maximum, even though the amount transported by the hemoglobin is hardly occurred. This small amount of extra oxygen may be the difference between life and death. مهما يكون صح هو المشكلة بالترانسبورت، لكن لما نبدأ أكسجين زايد ممكن نزيد الأكسجين ترانسبورت للزود ستيت، ممكن إنه هو في هيك حالة يفقد المريض من الموت. The different types of hypoxia caused by inadequate tissue use of oxygen there is an abnormality neither of oxygen picked up by the lung nor by the transport to the tissue. Instead, the tissue metabolic enzyme system is simply incapable of using the oxygen that is delivered. Therefore, oxygen therapy provides no measurable benefit. Cyanosis. The term cyanosis means bluish or blueness of the skin, and its cause is excessive amount of deoxygenated hemoglobin in the skin, blood vessels, especially in the capillaries. This deoxygenated hemoglobin has an intense dark blue purple color that is transmitted through the skin. In general, definite cyanosis appears whenever the arterial blood contains more than 5 grams of deoxygenated hemoglobin in each 100 ml of blood. A person with anemia almost never becomes cyanotic because there is not enough hemoglobin for 5 grams to be deoxygenated in 100 ml of arterial blood. Conversely, in a person with excess red blood cells, as occurred in polycythemia vera, the great excess of available hemoglobin that can become deoxygenated leads frequently to cyanosis, even under otherwise normal conditions. Types of cyanosis. We have peripheral cyanosis. It affects skin and the lips but spares the mucous membrane of the palate. It is caused by cutaneous vasoconstriction, which slows the flow and increases oxygen extraction in the skin. Peripheral cyanosis is physiological during exposure to cold, but it's also an important manifestation of heart failure, where sympathetically mediated cutaneous vasoconstriction occurs in response to reduced cardiac output. Central cyanosis, it is caused by reduced arterial oxygen saturation less than 85% at the lung where it is 97% saturation of hemoglobin normally, and affect the skin and mucous membrane of the mouth. It's seen in cardiac and chest disease, as in case of acute pulmonary edema, congenital heart disease, and the city bronchiectasis. وشكرا جزيلا. السلام عليكم.